There are moments in life when silence speaks louder than words, when humility hides stories that could change everything. What you are about to hear is one of those stories, a story about a woman who chose to keep quiet about her past, even while being disrespected daily. But sometimes, the truth has a way of revealing itself in the most unexpected moments, and when it does, it changes everything. This is the true account of a nurse whose hidden heroism came to light in the middle of an operating room, leaving everyone speechless. My name is Lieutenant Colonel Laura Mitchell, retired. But for the past 6 years, I have simply been Laura, a surgical nurse at Boston Memorial Hospital. Nobody here knows about the uniform I once wore, the missions I completed, or the lives I saved in places most people only see on the news. And that is exactly how I wanted it. After 20 years serving as an Army nurse in some of the most dangerous conflict zones in the world, including 3 tours in Afghanistan, I came back to civilian life seeking something I had lost: normalcy. I wanted to be just another healthcare worker, blending into the background, doing my job without fanfare or recognition. But working at Boston Memorial has been harder than I expected, not because of the work itself, but because of how I am treated. Dr. Richard Harrison, the chief surgeon, has made it clear from day one that he sees nurses as nothing more than assistants who follow orders without question. He talks down to us, dismisses our observations, and often makes demeaning comments in front of patients and staff. Just yesterday, during a routine procedure, he snapped at me for suggesting we check the patient's oxygen levels more frequently. He called me paranoid and told me to stick to what I know, implying I know very little. Before I continue, I want to know something from you. Where are you watching this story from? It is always incredible to see people from so many different places following these accounts. Write it down in the comments. I really want to know. The disrespect is not limited to Dr. Harrison. Several residents follow his lead, treating experienced nurses like me as if we are invisible or incompetent. They make jokes at our expense, ignore our clinical assessments, and sometimes even blame us for their own mistakes. I have been a nurse for over 2 decades, saved lives in field hospitals under enemy fire, trained dozens of combat medics, and received commendations for extraordinary service. But here, in this sterile, safe hospital in Massachusetts, I am treated like I just graduated nursing school yesterday. You might wonder why I do not speak up, why I do not tell them about my background. The truth is, I left that life behind for a reason. The military taught me discipline, resilience, and the importance of the mission over ego. I saw too many people use their rank and achievements as weapons, demanding respect rather than earning it through their daily actions. I decided that when I returned to civilian life, I would let my work speak for itself. I would be judged on what I do now, not what I did then. My husband David, a high school history teacher, often tells me I am too patient, that I should demand the respect I deserve. But he also understands why I choose silence. He was there when I came home from my last deployment, when the nightmares kept me awake, when the transition felt impossible. He knows that being just Laura, the quiet surgical nurse, is part of my healing. If this story is captivating you as much as it impacted me, take a moment now and subscribe to the channel. We are close to reaching 500 subscribers, and your subscription makes all the difference in helping more people discover emotional stories like this one. It was a Tuesday afternoon when everything changed. I was preparing for what seemed like a routine gallbladder removal, organizing instruments and checking the equipment as I always do. Dr. Harrison walked in with his usual arrogance, barely acknowledging the nursing staff. He was in the middle of making another condescending remark about how nurses should work faster when the emergency alarm sounded through the hospital corridors. Within seconds, we received word that a critical trauma patient was incoming, a high-ranking military officer involved in a serious vehicle accident near the base in Hanscom. Multiple injuries, internal bleeding suspected, condition unstable. All elective surgeries were immediately postponed, and our operating room was designated for the emergency case. The energy in the room shifted instantly. Dr. Harrison loves these high-pressure situations because they let him demonstrate his skills, but he also becomes even more demanding and short-tempered. As the trauma team wheeled in the patient, I felt my heart skip. Even through the blood and the chaos, even with an oxygen mask covering most of his face, I recognized him immediately. Major General Robert Caldwell, my former commanding officer, the man whose life I had saved 8 years ago in a forward operating base in Kandahar Province, Afghanistan. The man who had personally recommended me for the Army Commendation Medal with Valor device after I performed an emergency field procedure under direct enemy fire that kept him alive until we could evacuate him to a surgical facility. If this part moved you as much as it moved me, leave your like now. This way, YouTube understands that this story deserves to be seen by more people, and that really helps the channel continue growing. My hands moved automatically, following protocol, preparing for surgery, but my mind was racing. What were the chances? Of all the hospitals, of all the operating rooms, of all the nurses who could have been on duty that day, it had to be me, and it had to be him. Dr. Harrison was barking orders, asking for the patient's information, demanding updates from the paramedics who brought him in. I stayed focused on my tasks, trying to process the surreal situation unfolding before me. As we transferred General Caldwell onto the operating table, his eyes flickered open briefly. He was semi-conscious, disoriented from the pain and the trauma. His gaze swept across the room, unfocused at first, until it landed on me. For a moment, everything seemed to stop. Recognition flashed across his face, and despite his condition, despite the pain he must have been experiencing, he tried to speak. His voice came out weak and strained through the oxygen mask. "Mitchell, Lieutenant Colonel Mitchell, is that you?" His words were barely audible, but in the confined space of the operating room, everyone heard them. The surgical team froze. Dr. Harrison stopped mid-sentence, his mouth literally hanging open. The anesthesiologist looked up from checking vitals. The surgical residents exchanged confused glances, and I stood there, instruments in hand, meeting the general's eyes, knowing that the wall I had carefully built between my past and present was about to come crashing down. "Rest now, sir. You are in good hands. We are going to take care of you," I said quietly, my professional training overriding the emotional turmoil inside me. But Dr. Harrison was not about to let that moment pass. His face had gone from shock to curiosity to something that looked almost like embarrassment, though he tried to hide it. "Lieutenant Colonel?" Dr. Harrison repeated, his voice dripping with skepticism. "There must be some confusion. This is Laura Mitchell, one of our surgical nurses." He looked at me with narrowed eyes, as if I had been lying to him all along, as if I owed him an explanation for every part of my life he knew nothing about. General Caldwell, despite his pain and the medications beginning to take effect, managed to shake his head slightly. "No confusion. That is Colonel Mitchell, Army Nurse Corps. She saved my life. Kandahar, 2017. His words came in fragments, his strength fading as the anesthesia team increased his sedation to prepare him for surgery. But he had said enough. The atmosphere in that operating room had completely transformed. Everyone was staring at me now, not with the dismissive glances I had grown accustomed to, but with genuine shock and confusion. I could have explained everything right then. I could have told them about the night in Afghanistan when our forward operating base came under attack, when General Caldwell, then a colonel, was critically wounded by shrapnel from a mortar round. I could have described how I performed an emergency thoracotomy with minimal equipment in a bunker while explosions shook the walls around us. I could have mentioned the 3 hours I manually compressed his wounds while we waited for the fighting to die down, enough for a medical evacuation helicopter to reach us. I could have told them about the medal ceremony 6 months later, about the commendations, about the lives saved during my 2 decades of military service. But I did not, because we had a patient who needed immediate surgical intervention, and my personal history was irrelevant to the task at hand. "We need to focus on the surgery," I said firmly, redirecting everyone's attention back to the general lying on our table. The Dr. Harrison stumbled through the beginning of the procedure, clearly distracted by what he had just learned. His usual confident commands came out hesitant, and I noticed him glancing at me repeatedly, as if seeing me for the first time. The surgery itself was complex. The general had sustained liver lacerations, a ruptured spleen, several fractured ribs, and significant internal bleeding. It required every bit of skill and experience our team possessed. About 40 minutes into the operation, we hit a critical complication. The general's blood pressure began dropping rapidly despite our efforts to control the bleeding. Dr. Harrison was working on repairing the liver damage, but he was missing the source of a secondary bleed. I could see it clearly from my position, a tear in the splenic artery that was hidden behind other tissue. In the military, in field conditions, I would have called it out immediately without hesitation. But here, after months of having my observations dismissed, I paused. Then I remembered something General Caldwell once told me during a training exercise in Germany, years before the incident in Kandahar. He said that in critical moments, ego and hierarchy mean nothing, that the mission and the patient always come first, and that a good leader listens to everyone on their team because life-saving information can come from anywhere. So I spoke up. "Dr. Harrison, there is an arterial tear posterior to the spleen, approximately 2 centimeters from your current location. We need to address it now." My voice was steady and authoritative, the voice of someone who had commanded medical teams in the most stressful situations imaginable. To his credit, Dr. Harrison did not argue this time. He followed my direction, adjusted his approach, and located the tear exactly where I said said it would be. Within minutes, he had it clamped and repaired, and the general's vital signs began to stabilize. The rest of the surgery proceeded without incident, but the dynamic in that operating room had fundamentally shifted. Dr. Harrison, who usually dominated every conversation and decision, was actually listening when I offered observations. The residents who normally ignored the nursing staff were paying attention to everything I said, and I found myself stepping into a role I had not occupied in years, not just as a surgical nurse following orders, but as a true member of the medical team, contributing my expertise without apology. When we finally closed, and the general was stable enough to transfer to intensive care, there was a collective exhale of relief in the room. We had saved his life, working together as a real team for perhaps the first time since I had started at Boston Memorial. As we cleaned up and completed our documentation, Dr. Harrison approached me. His face was red, and he looked deeply uncomfortable, which was unusual for someone usually so confident and self-assured. Colonel Mitchell, I owe you an apology. Actually, I owe you many apologies. He struggled to find the right words, something I had never seen him do before. I have been disrespectful to you and to the entire nursing staff. Today you proved what I should have recognized from the beginning, that experience and expertise come in many forms, and that I have been a fool to dismiss the knowledge and observations of the people I work with every day. It was not a perfect apology. It did not erase months of condescending behavior and unprofessional treatment, but it was genuine, and it was a start. I nodded, accepting his words. What matters is that we saved a patient's life today, Dr. Harrison. That is always the mission. He smiled slightly at my use of the word mission, understanding perhaps for the first time that I viewed our work through a lens shaped by years of service in much harsher conditions than a modern American hospital. Over the next few days, as General Caldwell recovered in the intensive care unit, the story of what happened in that operating room spread through the hospital like wildfire. Suddenly, everyone wanted to know about the quiet surgical nurse who was actually a decorated military officer. The hospital administrator called me into her office, not to reprimand me for keeping secrets, but to express her gratitude for my service, and to ask why I had never mentioned my background during the hiring process. I explained that I wanted to be evaluated on my current abilities, not my past achievements, that I needed to build a new identity, separate from the military, that I was trying to heal from experiences that still haunted me. She listened with compassion and understanding, then told me the hospital would be honored to have me continue working there in any capacity I chose, with the full respect and recognition I deserved. But it was General Caldwell's insistence on speaking with the hospital's leadership that truly changed things.
Once he was well enough to communicate clearly, he requested a meeting with the administrator, Dr. Harrison, and several department heads. I was asked to be present as well. From his hospital bed, still connected to various monitors and IVs,
the general told them about Kandahar. He described the attack, the chaos, the moment he thought he would die in that bunker. And then he described what I did, how I opened his chest cavity with basic surgical tools, how I kept his heart beating manually when he went into cardiac arrest, how I held pressure on his wounds for 3 hours straight while coordinating his evacuation under fire. This woman, he said, his voice growing stronger with emotion, is one of the most skilled and courageous medical professionals I have ever known. She has saved lives under conditions that would break most people. She has trained combat medics who went on to save hundreds more lives. She received the Army Commendation Medal with Valor, the Meritorious Service Medal with 2 oak leaf clusters, and the Combat Medical Badge. She retired as a lieutenant colonel with over 20 years of exemplary service, and apparently you have been treating her like an inexperienced subordinate. Oh, the recognition that followed was overwhelming, and in many ways, exactly what I had been trying to avoid. The hospital featured me in their newsletter. Local news stations wanted to interview me about being a veteran transitioning to civilian healthcare. Colleagues who had barely acknowledged me before suddenly wanted to hear my stories and learn from my experience. Dr. Harrison went out of his way to publicly praise my contributions during staff meetings and began consulting me on complex cases. While all of this was validating in some ways, it also felt deeply uncomfortable. I appreciated the respect, of course. Being treated as a valued member of the healthcare team rather than an invisible assistant was certainly an improvement. But I had not wanted to be special or celebrated. I had wanted to be normal. I had wanted to leave behind the weight of those memories, those medals sitting in a box in my closet, those nights when I still woke up hearing explosions that were not really there. David noticed my internal struggle. One evening, as we sat on our back porch in our small house in Brookline, he asked me how I was really feeling about everything. I told him I felt exposed, vulnerable in a way I had not felt since coming home from my last deployment. I had created a safe space for myself as just Laura the nurse, and now that space felt invaded by Laura the the war hero, a title I never felt comfortable with. Maybe, David said thoughtfully, the lesson here is not that you have to be one or the other. Maybe you can be both, the experienced military officer and the humble civilian nurse, the decorated veteran and the person who just wants to do good work without fanfare. You do not have to perform your past for anyone, but you also do not have to hide it like something shameful. His words stayed with me as I returned to work in the following weeks. I realized that my desire for anonymity had been, in part, driven by a belief that my military service defined me completely, that if people knew about it, they would only see the medals and the uniform, not the person I am now. But what happened with General Caldwell taught me something different. My past and present are not separate identities in conflict with each other. They are different chapters of the same story, and both have shaped who I am today. I decided to embrace a middle path. I did not advertise my military background or bring it up unnecessarily, but I also stopped hiding it like a secret. When new staff members joined the hospital and asked about my experience, I mentioned my military service matter-of-factly, the same way I would mention any previous job. When my observations during procedures could benefit from context, I explained where that knowledge came from without apology. And most importantly, I continued to demand the respect that all nurses deserve, not because of my unique background, but because every healthcare worker brings valuable expertise to the team. General Caldwell made a full recovery and returned to active duty several months later. Before he left Boston, he came to the hospital to thank the entire surgical team, but he asked to speak with me privately. He told me he was proud of the person I had become after leaving the military, that choosing to continue serving people in a different capacity showed true dedication to the mission of saving lives. He said that humility is a virtue, but so is recognizing our own worth and not allowing others to diminish it. Today, I am still Laura Mitchell, surgical nurse at Boston Memorial Hospital, but I am also Lieutenant Colonel Laura Mitchell, retired United States Army Nurse Corps. Both identities coexist, and I have learned that honoring my past does not prevent me from building my future. The respect I receive now is not just because people know about my military service. It is because I finally stopped accepting treatment that no healthcare professional, regardless of their background, should ever tolerate. Sometimes the most powerful thing we can do is simply acknowledge our own value, speak our truth when it matters, and demand the respect we deserve not through force or ego, but through the quiet confidence that comes from knowing exactly who we are and what we have overcome. And you, what would you do if you were in her place? Would you reveal your achievements to gain respect or continue in silence, letting the work speak for itself? Tell us here in the comments. I love knowing what you think about these real-life stories, and if this story touched you as much as it impacted me when I learned about it, do not forget to subscribe to the channel. There are many more emotional accounts from healthcare professionals waiting for you, and before you go, click on the next recommended video. I guarantee you will be even more surprised.